Hello and welcome to another episode of Academic English here at Verbling. We'll get started shortly. Just waiting for students to arrive in the class. Class should start within about 3 minutes. Luis,
Hi, Simon.
good morning, or not good morning,
No,
good afternoon.
no, good night for me. Good evening.
Good evening.
Good evening.
What time is it?
It's 7 o'clock, 7 p.m.
Yeah, it's good evening.
Good evening. Yeah. How's the baby? It's fine.
Today he's behaving, he's not crying as much.
Oh, but he used to cry very much.
Lately he has been, yes. He's um, normally
He's
only
not
crying if he's
quite.
hungry.
He's not a quite. Yes, hungry. We can understand.
Yeah. But you know what? You can't get away from it now. It's too late. Do you want another baby?
No, no. But in Canada, there is law for the mother, kind of license, mother license.
No, you don't have to get a license to be a mother, unfortunately.
Because here the mother has 6 months, I guess.
Oh, you mean maternity leave?
Yeah,
Yeah, it's a year here.
1 year.
Yeah.
Oh, great. Very awesome.
Yes. So, very exciting time. Oh, look, class is filling up. I'm now reaching the point where classes are always full now. So, it's always good to reserve your spot because you never know what's going to happen.
No, yes, I used to bubbling as well. We have to reserve with 6 hours.
Yeah. Well, I've seen it where a day ahead the class is completely full. Like I haven't had a class where there's been a spare spot in days now.
Actually, I reserved your class yesterday.
Really?
Yeah, because I know that during the day people.
All right. Guys, do me a favor. Go ahead and click on Google Drive and then click on Hangout Notes. Okay, because that's where I'm going to have today's lesson. Hi, Raphael.
Hello, Simon.
How are you today?
I'm okay. And you?
Good. Tuesday is today, right?
Yes, Tuesday.
Wonderful. Any good TV on tonight?
TV? I don't think so. I don't know. I think I don't even remember the last time I watched TV. But
Let me see. Is anything on tonight? House Hunters International, River Monsters, and The Supernatural. That's on tonight. So that's interesting. I like River Monsters. That's excellent. Everybody loves River Monsters. That's on tonight. Good. Yeah, it's always good to see what's on TV. All right, and let's see, who else do we have in the room? Hi, Mikhail.
Hi Simon, how are you?
I'm okay. How is your day?
Very well, thank you.
Good.
Relax, today relax. Learning a little English.
I did some painting today.
Sorry?
I did some home repair. I had to cut some wood, fix the patio, and do some painting.
Okay.
And Gabriel, how are you today?
Hi Simon, I am very well.
Excellent. Gabriel, do you have your class notes open?
Sorry, what?
Could you open your class notes, please?
Class note. Where? I have opened the Berlin application or
Yeah, Google
chat box.
Drive and then the Hangout notes. Okay, so we're going to go ahead and get started now with today's lesson. Raphael, you have Google Drive open?
Yes.
Okay. Could you read the first two paragraphs, please?
Academic English. Hundreds of thousands of the nation's seniors are misusing prescription drugs, including narcotic painkillers, anxiety medications, and other pharmaceuticals, for everything from joint pain to depression.
Thank you. Okay, so today's news article is all about prescription drugs and health, okay, from the lifestyle part of the newspaper. So we're going to read today's newspaper article together. We'll take turns. Your focus should be on the message behind the story. We're going to read this for about 24 minutes. Then we're going to discuss the story. So it's very important to pay attention and focus less on pronunciation, although I will help you if I see that you need help. Okay, so thank you, Raphael, for reading that paragraph. Let's see. Luis, could you read the next paragraph, please? Oh, sorry, Mikhail, could you read the next paragraph, please?
Okay. When Betty Van Hamburgen began treatment last year for the addiction to the prescription painkiller, she was told to bring along all her medication. She arrived with a shopping bag, boxes of transdermal patches laced with fentanyl and narcotin up to 100 times steroid morphine, bottle of bottle of hydrocodone, another powerful opioid, package of Xanax and addictive sedative.
Okay, let me hear you say Xanax.
Xanax,
Xanax. Thank you. Opioid. Hydrocodone.
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 Fentanyl.
Fentanyl.
Fen. Fentanyl. Okay. Transdermal. Laced. Thank you. Luis, could you read the next paragraph, please?
Yes. They kept saying, "How did you get so much?" recalls Van Amberg, 68, who had been on an increasingly potent mix of medication since a series of back surgeries 20 years earlier. The doctors just kept prescribing them. It was always, "Do you have pen? Let me give you a prescription." But I got addicted. I was a zombie.
There's that zombie word again. All right, let me hear you say the word increasingly.
Increasingly.
Always.
Increasingly.
Thank you.
Don't pronounce G, letter G.
Ing. Right? So it's ing. You don't pronounce the G like J. It's just ing. Increasingly.
Okay.
All right.
Simon,
Gabriel, could you read? Yes, sorry, Raphael.
may I ask you a little question about the meaning? What do you mean about nation seniors? It means old people.
Sorry, which word?
Nation seniors.
Where is that? What paragraph?
The first one. It's
Oh,
the same as-
nations, seniors. Well, okay, so look at it, right? The nations is possessive. Seniors are generally people 65 and older.
Okay.
So it's referring to the seniors within the country. Gabrielle, could you read the next paragraph, please?
Okay. Hundreds of thousands of the nation's seniors are missing prescription drugs, spurred by a medical community that often is quick to offer narcotic painkillers, anxiety medication, and other pharmaceuticals for everything from joint pain to depression. And despite a push by public health officials to slash dispensing rates, doctors are prescribing the highly addictive drugs at record levels.
Okay, thank you very much. All right, thousands.
Thousands.
Yeah, don't forget the S at the end. Misusing.
Misusing. What is that?
Okay, so let's say, do I have any drugs here? I don't. Hold on. You never know what the teacher has in his classroom. Okay, so here's a prescription, or not a prescription drug, it's what we call over-the-counter drug. Okay? It's for a cough. Now, it has on the side here directions. Okay?
Okay.
And it says use one every 2 to 3 hours. So if I use one every 3 hours, I'm using it properly. If I have one every hour, I'm misusing it. Okay? It's improperly using.
Okay.
Spurred.
What? Start? A spurt.
spurred.
What is that? I don't know what is that.
Say it,
Spurred.
please. Spurred. Okay.
Spurt.
Well, look
Spurt.
at the context here.
Encouraged.
Yeah, encouraged. Very good. Encouraged is what I would consider a synonym. So, for example, here we're talking about the misuse of prescription drugs. Okay, that is caused by the medical community or encouraged by the medical community, right?
Okay.
Anxiety.
Anxiety.
An,
Anxiety.
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 Better. Do you know what anxiety is?
Yes.
Okay, most of us do. Joint.
Joint.
Excellent. Alexandra, the next paragraph, please.
By many measures, rising overdose deaths, a spike in emergency room visits, increasing admissions to addiction treatment programs. The toll on the senior community is enormous. A USA Today review of government data finds.
Excellent, well done. Raphael, the next paragraph, please.
Sorry, which paragraph?
Are you not following us?
No, I'm just reading the beginning of this test.
There's a growing group of seniors.
There's this growing group of seniors. They have pain. They have anxiety. A lot of doctors have one thing in their toolbox, a prescription pad, says Mel Poe, a medical director at the Las Vegas Recovery Center. We treat seniors for pain and drug dependence. The doctor wants to make their life better, so they start on the meds.
Okay, very well done, sir. Excellent. Mikhail, next paragraph, please.
Sorry. Over time, patients build up a tolerance or suffer more pain, and they ask for more medication, Paul says. And without anyone necessarily realizing, it begins a sorry. Sorry. Realizing it begins a downward spiral with horrible consequences.
Okay, as we talked about yesterday, you've really got to pronounce those consonants, okay? So in future, if I suggest going a little slower until you can get those consonants down, because it makes it very hard for people to understand the words you're saying. For example, the word realizing sounded like rising. And you're going to find that when you're talking to people, it's going to be harder for them to understand. So let's go slower and focus on each consonant. Okay, let me hear you say realizing.
Realizing.
Spiral.
Spoiler.
Without.
Without.
Tolerance.
Tolerance.
Patience.
Patience.
Excellent. I mean, you do very well. Just take that time and remember in English, consonants are not silent.
Okay.
Simon,
Yes.
I don't understand the sense of what Paul says in the first part. Patients build up a tolerance or suffer more pain. Well, why do they suffer more pain if they take painkillers? And if they build up a tolerance again, why do they need painkillers?
That's a very good question, and not being a doctor, I can't answer that. And also, we probably have to read a little further to understand about that. But my limited understanding of how drugs work is the more you take it, the more used to it you become, the less effective they become. It's like alcohol.
That's what meant by tolerance, yeah, like resistance.
Resistance, yes.
And what about suffer more pain? If
the drug is no longer having an effect, then you're going to feel more pain.
Mm.
Okay, but let's read along a little further and we'll find out if that's the case.
Mm-hmm.
Next paragraph, please. Luis.
Older brains and bodies are prone to drug complications, from falls and respiratory failure to cognitive problems and dementia. Yet studies project the number of seniors misusing pharmaceuticals will continue to grow, fueled by aging baby boomers and the Medicaid-first approach many doctors take in treating them.
Okay, let me hear you say aging.
Aging.
Fueled.
Fueled.
Misusing.
Misusing.
Project.
Project.
Respiratory.
Respiratory.
Yeah, you notice how we don't say respiratory, we say respiratory.
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 Yeah. It's kind of like, what's that other word? Laboratory. It's spelled laboratory. And I usually say laboratory, but people look at me funny like I'm saying it wrong. Okay. Next paragraph, please. Gabriel.
Okay. Big problem, big toll. To assess the scope and impact of the prescription drugs problems among older Americans, Just Today stated that data from an array of federal agencies and private firms. Key findings.
Okay. Key.
Key.
Key findings.
Key findings.
Data.
Data.
Also pronounced data. Both are acceptable.
Date of data.
USA Today.
USA Today.
USS.
US.
Perfect. Assess.
Assess.
Drug.
What is drug? What is assess?
Okay, drug or assess, which one?
Assess.
Assess. To determine, to study, to come up with a result.
Okay. Okay.
The dictionary actually says to evaluate or estimate something.
Yes.
Okay. Next paragraph is a long one. Go ahead, please. Alexandra.
Me? Okay. I was going to ask, what is array?
Array?
Array.
Well, that word can mean anything. Well, sorry, it can't mean anything. It can mean many things. In this case, it means from several or many. Okay. Array has multiple definitions, though. It's a good one to look up in the dictionary. It can function as a noun or a verb. It can be an ordered arrangement of something or an impressive display of a number of things like telescopes. You can have many telescopes in an array serving a single purpose. Okay, and an array in that case could be literally hundreds.
Array is same to a collection?
It could be.
Is same to a collection?
It could be.
Okay.
All right, please read the paragraph, Alexandra.
More prescriptions. The medical community is increasingly giving older patients prescriptions for two especially addictive drug classes: opioid pain relievers and benzodiazepines. Psychoactive medications such as Xanax and Valium, often used for anxiety. According to data collected from IMS Health, which tracks drug dispensing for the government, the 55 million opioid prescriptions written last year for people 65 and over marked a 20% increase over 5 years, nearly double the growth rate of the senior population. The number of benzodiazepine prescriptions climbed 12% over that period to 28.4 million.
Benzodiazepine.
Benzodiazepine.
As good as I could expect for such a crazy word that you'll never use again. Now, we generally say opiate.
Opiate.
Valium.
Interesting. Valium.
Psychoactive.
Psychoactive.
And here's our friend one more time.
Wait, benzodiazepine.
Yeah, actually very good. You forgot the S, but don't worry about it.
Benzodiazepines.
Okay, next paragraph. Talita, are you there?
Yeah, I'm here, but I don't have the text. So.
Yeah, just go into Google Drive and click on Class Hangout Notes, and you'll see everything. In the meantime, please just read the paragraph I put in group chat.
Okay. More misuse. In 2012, the average number of senior misusing of dependent on prescription pain relievers in the past year grew to an estimate. I have problem with numbers. Okay. Numbers in English for me it's really complicated.
So look at the first number first.
336
and thousand.
Up from 100 32,000 a decade earlier, according to survey data from the Substance Abuse and Mental Health Service Administration. Misuse is defined as using the drugs without a prescription or not as prescribed.
Okay. Let me hear you say misuse.
Misuse.
Defined.
Defined.
Estimated.
Estimated.
Grew.
Grew.
Relievers.
Relievers.
Misusing.
Misusing.
And generally with years, we don't say 2012, we say 2012.
Okay.
Nothing wrong with 2012, it's just not cool.
Okay.
So 2001.
Okay.
Okay. Let's see. Alexandra, if you could type instructions in the group chat for students who've just come in and how they can find the class notes, and I'll continue along with Raphael. Raphael, next paragraph, please.
More damage. Among people 25 and older seeking substance abuse treatment for 2007 to 11, there was a 46% jump in the share of cases involving prescription narcotics. Some SAMHSA data show annual emergency room visited by people 65 and over for misuse in pharmaceuticals climbed more than 50% during that time, to more than 94,000 a year. And the rate of overdose deaths among people 25 and older, regardless of drug type, nearly tripled from 1999 to 2010 to 9.4 fatalities per 100,000 people, based on the data from the Centers of Disease Control and Prevention.
Well done, Raphael. Let me just hear you say that phrase that I have highlighted.
Overdose deaths.
Yeah, I thought so. It was just a minor slip-up, but I thought you knew how to say that, so well done. Okay, so Mikhail, I want you to just go slow. Focus on each consonant and take your time. We're all here to learn, so don't feel stressed. Whenever you're ready, please.
Okay. The misuse of prescription medication by seniors has the hallmark of an emerging epidemic, said Wilson Carton, a psychiatrist and deputy director of the National Institute of Drug Abuse, part of the National Institute of Health. Both prescribers and patients need better education on the use of risk of painkillers and psychoactive drugs. Compton says, we have no focus on specializing on this older population, as well might. It's a serious problem.
Okay, first of all, much better.
Thank you.
Much better. Seniors.
Seniors.
Says. Psychiatrist.
Psychiatrist.
Kai. Atrist. Psychiatrist.
Psychiatrist.
Much better. Deputy. Drug abuse. Prescribers. Psychoactive. Specifically. Much better. Well done. So remember, Don't go fast, just go slow, okay?
Thank you.
You're very welcome, Mikhail. All right, Luis, I want you to read the next 2 paragraphs because, well, otherwise it's too short a paragraph for you. Go ahead, please.
Lives taking over. Van Amberg figures the doctors treating her back pain wanted to help. By the time she figured out that they were doing just the opposite, it was too late. Through 2 decades of back pain, she saw general practitioners, orthopedists, pain specialists. It would access her drug regime, maybe switch a narcotic, tweak a dosage.
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 All right, orthopedist. No, that doesn't sound right. Let me just see the pronunciation for that. It's a word I haven't seen before. Ortho means mouth.
Orthopedist.
Orthopedics. Orthopedics. There we go. Orthopedics.
Orthopedist.
Practitioners.
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 Decades.
Decades.
Through.
Through.
Orthopedics.
Orthopedics.
Thank you very much. All right, Gabriel, let's go down to the next page, and I want you to read the next 2 paragraphs that I have highlighted.
Okay. No one ever told me to cut back, she said. Over time, Van Harbor felt too foggy to drive, so she gave up her license. She grew insulated, distant from friends, even her 2 grown daughters. By last summer, she was sleeping through her cherished family vacation.
Cherished.
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 Cherished. What is that?
Something that you like very much. Foggy.
Foggy.
License.
License.
Okay, excellent. I'm going to stop right there. And it's not because somebody left the class. It's because now we get to spend the rest of the class talking about what we've read. You can see the rest of the article there that we're reading from USA Today. However, this is not a class about reading or speaking or pronunciation. Yes, those are attributes. But what I want to focus on is a discussion now. You guys have told me privately that you need more time to talk. That's where this focus is. We get to have a discussion. So the first thing I want to do, and I'm going to go to the very bottom of the article. I don't know what page that's on, but it's way down towards the bottom. And I'm going to type out class discussion. Below that, I want each one of you to write points about the article. Okay, and I will ask each of you to tell me what this story is about. So at the very bottom of the document, you'll see a heading called Class Discussion. Right, so I want everybody to go to the bottom. I'll show you what it looks like. Okay, so right at the bottom. And I want you to tell me what the story is about. Raphael, why don't you start us off since nobody's writing right now? What's this story about?
It's about the misuse of medication, the increase of the prescription of medications to pain given by doctors without any responsibility. They are just prescribing the medication, and people are getting addicted to this medication, and some of them are no longer taking effect. And at the same time, there are people taking medication at free will without any prescription, and that is raised the number of deaths related with this uncontrolled, unchecked use of this medication.
Okay, very good. Mikhail, anything else you would like to add about the story? What else did you notice?
Well, for me it's difficult to explain this vocabulary, but I understand the principle. The notice, the information given in this article is important because I think you can prescription you have, or you have the orientation, the medical, the prescription, the information is important to understand, because you can take your prescription, you one.
Well, they should be safe, right? You think your doctor has your best interest at heart, right?
Yes.
Okay. Luis, what can you tell us about this story?
Yes, what shocked me that is the number of the people with further 65 years old that visit the emergency room increase, I guess, more than 50% because of the misusing of the drugs, and the rate of death increased as well.
Yeah. Sometimes it seems, at least in the US, that it's more important to prescribe drugs than to get to the root of the problem. Let's try to attack the symptoms than the underlying cause.
Yes.
So, for example, I'm seeing a specialist right now, and instead of just giving me drugs, he's actually trying to treat the problem so that I don't need any further drugs or treatments. This is a problem I've had for 3 years, and it's painful. I have back pain. And prior to meeting this doctor, I had to go for acupuncture twice a week. I couldn't sit for more than half an hour without my back bothering me.
Oh, really?
Yeah, and then now that I'm seeing a neurosurgeon, he says, oh yes, there's 3 things going on here. He lists them off, and he says, okay, this is what I recommend we do. And the problem or the pain has decreased dramatically, which is great. So, yeah, too often people are prescribing, or doctors are prescribing, pain medication to fix the symptoms instead of the underlying problem. Gabrielle, what else can you tell us about this story?
When the article says about the problems for addiction to the drugs and senior people, the article says the senior people have a problem with respiratory failure and dementia. In US try the problem analyzing the data. In that analysis, they find more prescriptions and 2 types of drugs. That drugs are opioid, benzodiazepines.
Okay, so they're narcotics as well. And opiates.
Yes.
That's not spelled right. I knew there's something missing. Probably need another I in there. Yeah. Okay, very good. Alexandra, what else does the article talk about?
Just a moment. I lost that passage.
Oh, you're not supposed to look at it from memory. I know you were helping another
No,
student.
I was going to ask because it says here that in 2012 the average number of seniors misusing or dependent on prescription relievers grew, yeah? And then they give a definition that misuse is defined as using the drugs without a prescription or not as prescribed. Then I have a question. If they say that in 2012 the seniors misusing drugs which were prescribed, why do they define misuse as using drugs which are over the counter? And if they are not over the counter, so they use it not as prescribed, so I guess that they tend to use more. But how can they use more if you can take only the amount of the number of drugs which is prescribed and which is restricted? So you can't take more at the chemist. I don't understand. Why do they?
Well, I don't understand either because you just asked me about 7 questions and I can't remember any of them. So what I might recommend is write them all down and I can answer each one.
Well, my only question is why misuse is defined as using the drugs without a prescription if earlier they say that misuse is based on drugs which are prescribed?
Well, if you wanted to know why the writer of the story, said that, then I would suggest contacting the writer because I can't speculate on what the writer has said. Maybe it's an error, I don't know. But obviously, misuse of a drug is anything that goes against the directions. So if you don't follow the directions, that's misuse. If you don't follow the dosage recommendation, that's misuse. If you don't have a prescription for a prescription drug, that's misuse.
But if you have a prescription, how can you take more?
Easy.
So you are allowed, with one prescription, you are allowed to take as many as you want?
No, with one prescription, you can take them all at once if you want to. There's no one stopping you from taking them all at once. But that would be misuse. You might be dead, but it would certainly be misuse.
In Russia, it's different. If they prescribe you one med, you are allowed to take only one.
Yeah, but it doesn't stop somebody from taking more than one. So here we go. Look, we've got a bunch of them here, right?
Yeah, because inside
What
the box
stops me from taking 2 of them right now?
There's a lot of pills.
Right? Whoops, I'm dropping them. I can take both of these, and if I do, no one's going to come to the door and arrest me. Right? So there are many reasons as to why somebody might misuse a prescription, but there's nothing stopping somebody from misusing a drug.
Mm-hmm.
Okay. Luis, what do you think? Give us your medical opinion of this story. Hit hard. What's wrong with this? The reality of this story.
I guess the writer of this article writes about the situation in the United States, right?
Yes.
Because I didn't know that. I'm a bit surprised that the number of some kind of medication was prescribed in a high rate in the United States, like benzodiazepines opioids. I don't know the name in English, but we've read on this article. And this kind of medication has a lot of side effects.
Yep.
We have to prescribe with more safe for our patients. So
narcotics are very dangerous.
According of the article, the doctors on my state are going to prescribe with like the benzodiazepine is similar with paracetamol or like another ordinary medication. That is concerning when this is happening.
Are you familiar with a drug called Oxycontin? Contin, something like that.
I don't know if there is in Brazil, this medication.
Well, this drug is a narcotic, and when it first came out, the drug company told doctors that this thing is as good as morphine, but it's not addictive at all. So they started prescribing it a lot. Turns out this drug is highly addictive, as you'd expect morphine to be. The company actually got sued for billions of dollars through misrepresentation, and it really destroyed the lives of a lot of people, because if you can imagine being prescribed heroin and then trying to stop on your own, how difficult that would be. Oxycontin was one of those highly addictive drugs. So,
yeah, I guess there is not in Brazil this medication.
Let me ask Raphael this. So, Raphael, what is the moral of the story here? As a patient, what should you do?
As a patient, I need to. Firstly, I need to believe in what the doctors are saying. If they are prescribing the right dose for my problem, I should believe in what they are saying and what they are prescribing. And what else? We need to. In my opinion, there is a huge network of interest, because these laboratories, they want to sell medication, they want to sell medicine. There is a how can I say? It's a conspiracy. There is a huge worldwide conspiracy in medicine in order to sell, because they want to sell more and more and more medicine, because it's a very profitable market. So, in my opinion, they are playing with people's lives.
Well, let me ask Gabriel this question. Should you as a patient always trust what your doctor says, or should you take an active role in your own health and ask questions?
Sorry, can you repeat the question, please?
Should you always trust a doctor, or should you ask questions?
I don't always trust in doctors. I search for a second opinion about prescription.
Sure.
So,
you can get a second opinion. That's one option.
Yes. But I can say other things about this problem, because this problem is in various countries. In my country, that problem is big. So I think more control in the doctor for give that prescription.
That's a good point, but let me put this out there. As a patient, you have a direct interest in the health you're given. If a doctor prescribes something to you, shouldn't you ask what are the side effects of a certain drug? For example, when I went to get back injections, I asked the doctor, I said, are these narcotics? I don't want to take any narcotics.
Yes,
You've got to take an active role and ask questions yourself. You can't just say, yeah, I feel pain, can you give me something? Right?
Well, Well, I take the prescription and search for a second opinion, or I searching in Google about the prescription and your effects.
Okay.
So if I have a doubt about that prescription, I ask to the doctor for that effect.
Okay, good. Thank you. Alexandra, trust your doctor or trust your doctor and ask him questions?
Second.
Or am I oversimplifying the problem?
I don't know.
That's an honest answer.
I don't know. Maybe I don't know, because I am among those people who don't even take a medication from my headache. So if I have a headache, I'd better suffer for a little bit, go to bed, stay in complete silence, but I will try to overcome this issue on my own.
There's nothing wrong with that.
I usually don't take any painkillers or stuff like that. I think there are other ways to help the person, because you can get, I don't know, drowned. You can get drowned in all those medications. So I support those painkillers only if it's a terminal disease, when we already know what the ending will be, but we want to help this person to overcome those big pain, great pains. So only in this case, but in other cases you should just get a proper treatment, but not just get drowned in those medications, hide your real problem by those things.
Well, it's some very good points. Like with anything, guys, buyer beware. Whether you're taking your car in for service, whether you're buying organic foods, do a little bit of research. Don't just trust other people. For example, as a patient, if you don't tell a doctor much, you don't give him a lot of details, you don't tell him what other drugs you're on and this sort of stuff, then he can't help you in the best possible way. If he does give you a drug, ask him while you're there in his office, what are the side effects of this drug? How real are the side effects? What are the likelihood? If you don't trust what your doctor's saying, then get a second opinion. But you've got to, we as our patients have to take some responsibility on ourselves. But then there's also a sense of legislation. If something is happening so often that's causing harm, then maybe we need some sort of legislation to help, right? But some very good comments here. This is a very interesting story. There's a lot of interesting vocabulary in here. And yeah, it's about drug abuse and drug addiction. You guys might want to do a bit of research if you enjoy medical articles. A couple of years there was a story about OxyContin. Very, very addictive narcotic that was sold as not being addictive, as I mentioned earlier. Very interesting. I don't even know if you can get that anywhere. I've seen signs at my pharmacy saying we do not sell OxyContin here. All right. Guys, any questions? We've got about 6 minutes left. All right. Now, Luis, this is probably your first academic English with me. It's a little different than the ones I've taught in the past.
Yes.
Because we do focus on pronunciation, which we didn't so much before. So there's reading, writing. You guys were bad. You didn't do any writing this time, but part of it is to also write as well at the same time. So it's a lot more intensive class, and it's designed more for intermediate and advanced students. Coming up in 1 hour from now, I have a class that Raphael asked for, and I know some of you were here last night, and we're going to practice job interviews. I'm going to have a list of interview questions, and I'll talk to you guys a little bit about how to answer job interview questions, and then we'll practice that, and you guys will even break off into pairs and interview each other, so you guys get to do a lot of the speaking. So what you'll get out of this class, you'll get to see common interview questions that are asked in English, and I'll also comment on your answers. What are businesses looking for? If you're going to attend that class, I recommend doing a little bit of research on things such as soft skills. Okay, what are they? And to research, what are companies looking for? That's all coming up in an hour. And I am here every day up until Sunday. Tomorrow, or Wednesday, I have a class, the 5th part in a 13-part series on project management. We're going to talk about cost management this time. And the second class is a marketing course. So what I'm going to have you guys do is imagine yourself working for either Apple or Samsung. And as Apple, you're coming out with the new iPhone 6, and as Samsung, you're coming out with the new Galaxy Fandangle Galaxy 6, S6 or whatever they call it. And you're going to have to do a bit of research and try to convince me to buy either the Galaxy or the iPhone. So it's a little bit of a debate, but not so much a debate because you're trying to convince me. It's a one-on-one. You'll come up with a 30-second pitch to convince me why I should buy your company's smartphone. Okay? So a little bit of speaking, some research, some reading. Should be a fun class. And then on Thursday, right now I just have, I have 2 classes. Pronunciation, and I have one at 2 in the afternoon, and I don't know what that's going to be yet. I've got to figure it out. And then on Friday, we're back with academic English and game class. Okay, that kind of rounds out the week. Any last questions, guys? Okay, as always, everything that I have here in the Hangout notes, you're free to copy, take with you. You can always go back and rewatch the class and focus on some of the pronunciations we worked with. Again, this is not a pronunciation class, so my focus here is not on pronunciation, but if I can help you a little bit, I do spend some time on that. But if you guys have no further questions, then that's it. There's nothing else to add. There's no more questions?
No, thank you.
No, no, thanks.
Thank you.
All right, guys. Thanks for coming out today, guys. I hope. Who's going to be here in the next hour?
Okay, bye.
I'll try.
Okay, yeah, it's not that late there.
Uh-huh.
All right, Luis, are you going to be there?
Yeah, I will try.
Excellent.
That's kind of business.
It is. It is a business-like class. And Raphael, how about you, sir?
Yes, yes.
All right, and Mikhail, Gabriel, you guys going to join us?
Okay, Simon, I try
All right.
to learn a little about, I don't know more, I don't have a technical idea about this.
Don't worry about that. The focus in the next hour is not on the Apple versus Samsung. It's more about job interview questions. So hopefully, guys, I will see you in an hour from now. In the meantime, have a good evening. We'll see you soon.
Okay.
Bye-bye, guys.
Bye.
Okay, bye-bye.
Bye-bye.